Finance Committee will come to order. And on behalf of Senator Crapo and myself, it is our hope that this morning's hearing on the state of mental health for our youth serves as a wake-up call. Millions of young Americans are struggling under a mental health epidemic, struggling in school, struggling with addiction or isolation, struggling to make it from one day to the next. Our country is in danger of losing much of a generation if mental health care remains business as usual. For families across the land, this is the issue that dominates their living rooms and their kitchens with the Children's Health Insurance Program and Medicaid, the largest payers of mental health care for vulnerable young people. They're within our jurisdiction, and that means the Finance Committee has got to come up with solutions. I hear way too many heartbreaking stories from parents and young people at Oregon town hall meetings, at the grocery store, in the schools that I visited across the state. I'm certain that's the way for every member of this committee. Imagine being a parent, scrambling desperately to find help for your kid who's in crisis, who may be a danger to themselves or somebody else. Too many parents are making call after call after call, only to find there aren't any beds available, or that the wait list to see a psychiatrist could be weeks or months long, or they're told that their insurance company won't pay for the care that a psychiatrist says their child needs. Now, the law requires equality between coverage for physical health and coverage for mental health. Yet too many families in America are put through bureaucratic torment when they try to get that coverage that they pay vast sums for. Your kid is suffering, the insurance company takes thousands of dollars in premiums from your pocket, and yet often you get little more than jazz in your ear while you sit on hold. So there's new urgency for the Congress. Diagnosing an issue and getting the right care for young people was plenty hard before anybody had ever heard of COVID-19. The crisis is significantly larger today. Kids are feeling isolated, depression is up. Suicide attempts are up. An estimated 140,000 kids have lost a parent or a caretaker to COVID-19. That number will continue to rise. The bottom line, every loving parent wants what's best for their child. So as a nation, can't we come together and show the same level of concern for our young people? And that's why having Dr. Murthy here is so valuable, because he put out at the end of the year a clarion call to the country to come together, recognize how serious this is, and take it on. So we're very fortunate to have him. He's been a crusader for improving mental health care for our kids. He spent some time in Eugene, Oregon, where, of course, our now famous Cahoots program that brought together mental health providers and law enforcement people to tackle mental health got started. And Dr. Murthy is going to help us attack the challenge from all sides, including how to help families navigate a broken, complicated mental health care system, how to respond to a young person in crisis without demonizing them or criminalizing them, how to build on what's proven to work when it comes to health care for kids, specifically CHIP and Medicaid. And when it comes to showing what works, our colleague Senator Stabenow and her terrific work on behavioral health has been a real, in our part of the world, we call it a trailblazer for showing how to make sure that kids get help. So here's the road ahead for the committee. And I want to thank Senator Crapo. We have spent months and months saying that this is going to be a bipartisan effort. We know that the political scene is polarized. We believe this is so important. We've got to work on a bipartisan basis. And with today's hearing, the Finance Committee ramps up our legislative efforts. Several of our members are going to be partnering on specific policy challenges. We will have one Democrat and one Republican. The goal is to produce a bipartisan bill that brings all together. Senators Carper and Cassidy will be focusing on the subject of today's hearing, mental health care for America's children. I have heard both of them, Senator Carper and Senator Cassidy, talk passionately about how taking care of kids here is the ball game, because we all understand it. You got a choice. You can get there early, or if you don't, you play catch-up ball for years and years to come. Then we'll have Senator Stabenow and Senator Daines working on the mental health care workforce. So part of this, and you see it with Senator Stabenow's great work on behavioral health, you can have a great program. We need more workforce. And all over the country, we're hearing about challenges there. Senator Cortez Masto and Senator Cornyn will look at how to make mental health care more seamless, because too many people fall between the cracks. Senator Bennett and Senator Burr will focus on how mental health care gets finally treated the same way as physical health care. A special passion of mine, particularly because we launched our investigations after a debacle at the Oregon Health Sciences Center where they couldn't get their claims paid early on in the pandemic because the insurance companies were stalling. Senators Cardin and Thune will team up on making it easier to get mental health care via telehealth. And finally, I want to just mention what the direction here is, really the lodestar for what the committee really has talked about in the past. Everybody in America must be able to get the mental health care they need when they need it. That is really the North Star here. So we're going to stay busy with hearings featuring mental health experts and advocates. This morning's hearing will be the first of two that put a special focus on our young people. And before wrapping up, I'd like to say, because he's not here today, I want to thank the Senator from South Carolina, Senator Scott, who has talked with me at considerable length about the cahoots bill that I mentioned. We were able to secure $1 billion in Medicaid for. He is just instrumental in this alliance between mental health people and law enforcement, because both groups want to focus on what they have been trained for. Mental health folks want to focus on mental health. Law enforcement say, we don't want to focus on mental health. We want to focus on what we're trained for. Senator Scott's been very helpful. So, Dr. Murthy, thank you for joining us. We're going to turn it over to Senator Crapo for his opening remarks.